chest tube. Chest tube is a flexible plastic tube that is inserted through the side of the chest in the pleural spill to expand the lungs. So the purpose of chest tube, it is used to remove air, fluid, or pus to establish normal negative pressure in the pleural cavity for lung expansion, to equalize pressure on both sides of the thoracic cavity, and lastly, to provide continuous suction to prevent tension in pneumothorax. Indication for chest tube. First, pneumothorax. It is an accumulation of air in the pleural cavity. Next is pleural effusion, accumulation of fluid in the pleural cavity. Chylothorax, a collection of lymphatic fluid in the pleural cavity. Empyema, a pyogenic infection of the pleural space. Hemothorax, accumulation of blood. Hydrothorax, accumulation of serous fluid. Procedure of chest tube. First, confirm the procedure. Next, inform patient. Check for the consent. Prepare all the equipment. Then position your patient. During the procedure, make sure to observe and monitor patient's respiration and saturation by placing oxygen oximeter on the finger. Reduce patient anxiety.
First, I have to do my safety assessment, or I have to introduce myself, and then do the vital signs and my respiratory. After my initial assessment, I'm going to do my hand hygiene. Then I'm going to put on my gloves and check the old dressing. I take off the old dressing. I'm going to look for drainage, amount, color, and if it smells bad. Then after that, I take my gloves off, throw it in the basket, the garbage, and then I'm gonna start my skill. And then I'm gonna go ahead with my skill, and I'm gonna check my solution. If it's the right date, the right solution, and stuff like that. And then I'm gonna open my dressing tray. Garbage. And then I'm gonna pour my solution. Then I'm gonna wear my gloves. Put my gloves on. I'm gonna have my tray set up. I'm gonna have my dressing, my special dressing, and gel on it. So let's go ahead and clean. Alright, let's go ahead and put on the drapes. So this is a sterile gloves. So you put on the drapes. And after that, I'm going to grab cleaning materials, and I'm going to go ahead and clean the wound. Make a one. That's how you call it. From the bottom, and with the circle, to the other side. Trash that one. another one. Again, further away from the wound. Bottom, the other side. Then after that, I'm gonna get the 4x4 dressing. Holding it through. And then the sides. Now I'm gonna have to dry the wound. Gonna make a one tone again. From the bottom, the other side. Do it twice, further away from the wound. Go from the bottom again. Other side. Now you need to dry. Now you need to dry your tube, the area that you cleaned. Challenging. So try that. Then after that, you put on your gel on it. You put it in a triangle. Do it 3 times. Put it around the wound or the tube, sticking to the wound. Sure it wraps around it. Then after that, put on your special dressing, which is the one that has slit on the middle. So this one goes on top. And the other one goes in the bottom. And it always needs to be that way, the one on top, the one facing the bottom. Then after that, you put on your 4x4 dressing. On top of it. And now you tape it. So that's done. You can take this out. Where's our tape? Now we tape it. We can take this off. That's
Can
how
you
do
tape it?
Oh, you're gonna do your client assessment again. You're gonna assess her respiratory system and make her comfortable when you leave her on bed.
After the procedure, make sure to monitor vital signs. The first 15 minutes, then 30 minutes, then first hour for the next 4 hours until the patient is stable.
Go.
Take note of the respiration, the rate, pattern, the rhythm. Check saturation. Administer oxygen when necessary. So my name is Neil. I'll be your nurse. Today I'm going to teach you on things how to care for yourself and for your tubing. So for your chest tube, I mean. So first, make sure you maintain high Fowler's position when you're sitting.
Okay.
Next, I'm going to teach you how to do deep breathing and coughing. So first, you're going to do deep breaths 4 times.
Okay, so
I mean, like deep breath first, and then cough. Okay, that's good. Do it every 4 times every 2 hours.
okay.
And next, make sure to look any signs of infection. So, or sign of infection, exaggerated pain around the tubing.
Okay.
Any redness, any swelling around the tubing,
Okay.
any pus drainage.
Okay. So there's redness, pain, exaggerated pain, pus in the tubing.
Yeah.
Yeah. That's it?
And swelling.
Okay, swelling. Okay.
And call me if you have any signs of that.
Okay.
So we can check your tubing. And also, next, avoid kinking of the tubing.
Okay. I'll take
So
care of
no
the tubing.
unnecessary clamping of the tubing.
Okay.
When you're in bed, make sure to place pillow between you and the tubing.
Okay.
So
So I'll
tubing,
put it right here.
tubing,
And the tube is here. Okay.
pillow, and then you.
Okay.
Then next, make sure when you are in bed, change your position to promote drainage.
Mm-hmm. And I do that too to relieve pain too.
Yeah, you can do that too if you have any pain.
Okay.
So that's it. If you have any question,
I can call.
don't hesitate to call us.
Okay.
And
All right.
good luck.
Thank you. Today you learned about chest tubes
Chest tube care.
and patient teaching about chest tubes. Thank you for listening and thanks for watching. And this is Ivitz
I'm Neil.
and stay cool.